Same.
Like I'm sitting at a pretty
So I wanted to get the whole. I might want to get the whole car painted and everything. So I had to go down there, and he did. He said it charged me $3,500
Oh, Lord, that's a lot.
because it's dents all around the car, all kind of scratches and scrapes on the car. It's all kind of colored yellow and red on the car, girl, from me pulling into my parking stall, and it's so tight, and me just tearing my car up on the pole. So I don't know. This is like the third time I done got fixed.
All right, let me see. Okay, so we ready, guys? Can you hear me?
Yes.
Yes.
You can hear me, okay. All right. Let's see. Okay. Who can tell me what the functions of the immune system are? Yep, and it's a surveillance network, exactly. What is innate immunity and what body parts provide innate immunity?
It's natural immunity. It's the first line of defense. And the body parts is the skin, the mucous membranes, the cilia, the vaginal and intestinal floral.
Saliva, right, tears, anything that you're born with. What food sensitivities are associated with latex allergies?
Eggs. Ink.
Shellfish.
Okay.
Bananas.
Bananas, tomatoes, water chestnuts, kiwi, right. What's necessary for B cell? So I have a different, did I miss something? Oh, what do you do if a patient receiving blood transfusion has chills or fever?
Stop the
You
infusion.
stop it, right? No matter what you do, you stop the blood, but you let the saline keep flowing, right? So you're going to leave the IV going because we have to have an open vein in case the patient has an anaphylactic shock reaction. We want that IV to be going, but we're going to stop the blood. What's necessary for B cell proliferation?
Antigen stimulation.
Antigen stimulation. And what is an antigen?
Protein.
It's usually a protein that causes a reaction, right? What's a negative effect, major negative effect of cell-mediated immunity? When it attacks your cell, when it attacks things, what's a problem with that?
It rejects the organ.
Right, right. So if you had a transplant, that cell-mediated immunity would still go after it. It would say, uh-oh, this liver does not belong in this body, and it would attack it. So it has a consequence, a negative effect on transplanted organs. Who can tell me what plasmapheresis is? Plasmapheresis is when we take the blood, say someone has lead poisoning. We're going to remove the blood, put it in a cell separator, spin it out, and remove the pathogen. So whatever is bothering the patient, if the patient having allergic reaction or it's causing the body an antigen bothering the patient, we would remove that. So that's what plasmapheresis is. We put it in a cell separator and we remove the pathogen. Does older adult have increased or decreased saliva and gastric secretion? And if so, what does that put them at risk for? Decreased saliva, decreased gastric secretions. So those would cause like GI types of problems, right? Oral problems, maybe more ulcers, GI irritation. What patients would be at risk for immunodeficiency disorder? Oh, I gave you the answer here. So what patients are at risk for immunodeficiency disorders? Patients on chemotherapy, patients on radiation therapy, patients on immunosuppressive therapy. If they have say they have a liver transplant and we need that liver to be healthy, to stay in their body. So we put them on immunosuppressive medications to decrease that. And so that would put the patient at risk for an immunodeficiency disorder. What does epinephrine do? Bronchodilate or bronchoconstrict?
Bronchodilate.
Bronchodilate and vasoconstrict, right? It bronchodilates, opens the airways. That's why we give it to patients with anaphylactic shock. We give them O2, we give them epinephrine, and it bronchodilates, opens the airways. If you had a mom driving carpool, would you put her on Benadryl or Allegra?
Allegra.
Would you put it on Benadryl or Claritin?
Claritin.
Right, because Benadryl is sedating. What's it called when a mom gives HIV to the baby, and how is that transmission effective? How does that happen?
Is it called vertical transmission?
Yes, that's exactly what it's called.
During pregnancy, during delivery, and breast milk.
During delivery of vaginal delivery, right. And so that's why we C-section the mom, and that's why we encourage bottle feeding. If the patient's immunocompromised, what's the patient at risk for?
Everything. Infection. Diseases.
Infection, right. They have a low threshold for infection, so we have to put that in the care plan. If you suspect the patient having an allergic reaction and anaphylaxis, you give them O2 and you give them epinephrine, 1 to 1,000, Q5 to 20 minutes. What is immunocompetence?
A functioning immune system.
I'm sorry?
A functioning immune system.
A functioning immune system, a healthy immune system, right. So if I got the flu today and tomorrow I'm better, I'm immunocompetent.
Mm-hmm.
What are those 2 signs of AIDS wasting syndrome? You remember the 2 main signs of AIDS wasting syndrome?
They lose 10% of body weight and diarrhea.
For 30 days, right. All right. What foods would you recommend for an AIDS patient with severe diarrhea? Would you give them raw vegetables or cooked vegetables?
Cooked.
Right, cooked. Would you give them Ensure or Coke?
Ensure.
Yeah, that's kind of common sense. But early signs of HIV. What do patients experience when they first get sick? I'm sorry. Yeah, right. So they get these early signs, right? Night sweats, fever. They kind of have flu-like symptoms, weight loss.
Yeah.
But those night sweats are one of the big ones. In the 80s, that's what everybody would get scared of. If they would ever get night sweats, they were like, "Oh my God, this is awful." Didn't always mean HIV, but that's one of the early signs.
So, that was my question. So, night sweats is like a early sign.
Yeah, and a late sign. Yeah, and a late sign. What would you tell a patient who says, "I don't want to take my ARTs"?
You tell. But it's a lifelong. You have to take it for your lifelong. So the disease won't progress.
Right. It's lifelong and it's life savings. If they don't want to take their ARTs, they can convert. You know, well, HIV positive HIV negative can convert to HIV positive, and HIV can progress to AIDS. So we do encourage our patients to take it. Do they have to take it round the clock or during the day only?
Round the clock.
Round the clock. And what happens if they miss dosage?
They can convert.
Yeah. I was going to say, that's what you say.
Go ahead, Steve. Yeah, they develop an immunity. They develop a resistance to the medicine. Yeah, so they must take their medications 24-hour period, and they can't miss. They just can't. For most people who are HIV positive, marker antibodies are usually present in 10 to 12 weeks after exposure. Oh, so what's it called when a person goes from HIV negative to HIV positive? Seroconversion, right? Seroconverting. That means they didn't have the antibodies, and we know what antibodies are, and now they have the antibodies. So they patient seroconverts. What's the most common method of HIV transmission today?
Sexual.
Sex. Disease progression of HIV. So this is the answer to the question right here. The disease progression, it's acute retroviral syndrome, early infection, early symptomatic disease, and then AIDS. That's the answer to that question. When the nurse is discussing confidentiality with an HIV patient, who should she encourage them to tell they have HIV?
The partners they slept with.
The partners they slept with. Anybody else? Us.
Family.
Well, yeah, I mean, but the healthcare worker too.
Oh, yeah.
We should know that you have HIV. Even though we're going to practice universal precautions, we should know. All right. True or false? Nutrition, exercise, reduce stress, support groups will improve your immune function. Absolutely true. Patients can have HIV for many years, right? They can go 20 years with HIV too, right? They may
Yes.
20 years and not even know they have it. Are they still infectious?
Yes.
Yeah.
What's kyphosate sarcoma and what does it look like?
It's a red.
White rash patches.
Red, blue, purple lesions on the patient's skin. Kyphosate sarcoma. Can a pregnant nurse take care of an AIDS patient?
Yes.
Yeah, absolutely. How do we test for HIV? What's the process? Right, ELISA, Western blot. So if you get your first ELISA and it's positive, we're going to do a second ELISA. If that's positive, we're going to do the more specific Western blot. Oh, so when do you get the diagnosis of AIDS? When do you progress? When is it changed from you are HIV positive to AIDS? What happens?
When you get a positive HIV. Yeah.
3 criteria. Opportunistic infections. So you have to have a history of opportunistic infections. And what are some opportunistic infections? Kyphosate sarcoma, thrush in your mouth, oral thrush, and then also like pneumocystic cardiac pneumonia, right? So to go from the diagnosis of HIV to AIDS, you have to be HIV positive, a CD4 count less than 200, and you have to have a history of opportunistic infections. What do we do to improve stomatitis? What can you do? Stomatitis is the ulcers that AIDS patients and chemotherapy patients both get, right? Their immune system's weakened, and so they develop these ulcers in their mouth. What can we do to make sure that a patient, we can relieve that a little bit?
So you want to avoid spicy foods.
Avoid spicy foods.
Oral care.
Oral care, good oral care, swishing with saline, using soft toothbrushes, cooked vegetables versus raw, those kind of things. What would a doctor do if a patient had an elevated PSA and the physician performed a rectal exam? What's the next thing they would do? Well, I don't know that this was even in our book, but it's on your test. So just write this in there. They would do a transrectal ultrasound. Okay, transrectal ultrasound. Okay. How does Cytoxan work? How do chemotherapeutic agents work? They interfere with the replication of the cell, the DNA of the cell. So that's how chemotherapy works. It goes in and it disrupts the replication of the cell. Okay. If you found a lump, I'm sorry. It does stop mitosis. It stops mitosis, yeah. But it's interrupting the cell process, the reproducing of the cell. If you found a lump in your breast, what would your next course of action be?
Get a mammogram?
Well, yeah. You would go to your clinician, have them check you, and then they would probably order a mammogram, and then they'd probably order a biopsy. Why would they order a biopsy?
To see if you have cancer or not.
Because that's the only definitive diagnosis for cancer is a biopsy, right?
Yeah.
What are the 7 warning signs of cancer? Remember the term caution? Change in bowel bladder, remember? Caution. I was going to share, but I'm not going to. So 7 warning signs of cancer. Caution. Can you guys see my screen? You can see, right?
Yeah.
Okay. So it was a change in bowel bladder, a wound that does not heal. Let's see if we can bring this up. A wound or sore that does not heal. Unusual bleeding or discharge, thickening or lump, that's kind of a nodule that you'd find. Indigestion or difficulty swallowing, obvious change in port or mole, and nagging, cough or hoarseness. Okay, so if you remember the term caution, you'll remember the 7 warning signs of cancer. All right. All right. What foods are good for preventing cancer?
Mangoes, brown rice.
Yeah. I thought everybody was going to yell broccoli. So yeah, so fresh fruits, fresh vegetables, roughage foods, foods that are high in fiber. All of those things are good at preventing cancer, right? So we're going to avoid the high fat, the really greasy kind of things all the time. Can you have a McDonald's burger every once in a while? Of course, but you can't have it every day. How should a cancer patient take their pain meds? Can you give pain meds in between? So how should you treat a cancer patient with pain meds so that they don't feel pain? Would you
schedule the pain meds?
Give it as needed. I mean,
you're gonna give it around the clock,
right.
And then you give it with breakthrough pain. But a cancer patient should have pain medications throughout a 24-hour period, because if you just give it to them in the day, they're not going to sleep well at night, right? Maybe their pain meds were ordered 10 a.m., 2 p.m., 6 p.m. Well, they really need it around the clock to control that pain. What you don't want is you don't want the pain to get the upper hand, okay? And then, of course, you can give them meds for breakthrough pain. Radiation fatigue is real. When a patient tells you they don't think they can go on because the radiation is exhausting them, what are you going to tell them?
Oh, you would ask them to clarify. Like you elaborate on it.
Okay. And is it going to get better when they are off radiation? Yes. So when they're having radiation therapy, it's 5 days a week for 6 weeks. The patients are literally exhausted. Plus they have cancer and maybe they're on chemo. So they just feel like they can't even get out of bed. But once they're done, they will feel better. And we have to remind them of that. Tell me some care, one person, so that not everybody's yelling, but how do you care for a patient with a radiation implant? Who wants to volunteer? TV, you want to volunteer?
I don't know it, Miss Robin.
You don't know?
I don't know that. I don't know that one.
I'll take a shot at it.
Go for it. Go for it, Nanette.
So they got to be isolated.
Private
You have to do, you're gonna give them they have to be isolated. You're gonna give them a bath from the neck up. I mean,
Yep.
from the waist up.
Mhm.
You're gonna be in and out with vital signs, very brief. And they know you there, but you can't be in the room.
Right, no more than 10 minutes.
Yeah.
All the linen it stays in the room. If the radiation implant falls out, you use the long-handled tongs to pick it up and put it in a lead liner container. No pregnant women taking care of the patients, no children under 18, maximum 10-minute visitation times. Sign on the door, see nurse's station before entering, okay?
Okay.
What should you do to keep patients safe if they have thrombocytopenia?
They're stocking.
I'm sorry?
They're stocking.
Okay, their stockings.
Stockings.
Thrombocytopenia,
And
Would you minimize the venipuncture?
minimize,
yeah.
minimize
Yeah.
the potential for bleeding, right? So no football sports, no, no
yeah.
contact sports. If you're gonna shave, use an electric razor, that kind of stuff to keep them from bleeding.
I'm tripping.
What are some signs well, let me ask you, if I had a tumor that was localized, is that benign or malignant?
Benign.
Benign. If it's encapsulated, is that benign or malignant?
Benign.
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 If it's spread, is that benign or malignant?
Malignant.
Malignant.
If it has a larger nucleus, a different number of chromosomes, different number of mitosis patterns.
Malignant.
Malignant. Okay,
Yeah.
so know those signs and symptoms. You can look those up if you don't remember the rest of them. What are some reasons patients delay seeking medical care when they have warning signs? So if you have a patient that had 6 of the 7 warning signs of cancer, why do you think that patient might not have gone to the doctor?
They were scared.
Yeah.
They were scared. They were fearful, right? They don't want to know. That's what my sister did when she had the terrible eating patterns, and then she started having rectal bleeding. She was like, I'm not going. She never said a word to anybody, and then it was too late. So patients get scared. I don't know if they think it's going to go away. They don't want to hear the diagnosis out loud. I'm not sure. What's an excisional biopsy, and how is that done? How do you close an excisional biopsy? No, an excisional biopsy, remember, that's the wide excision, and then we suture it shut. Second degree healing or secondary intention is when, like, a wound eviscerate or a wound dehiscence, and we let that heal by secondary intention. But an excisional biopsy, we go in and we do that wide excision, so we get all the cancer cells around the tumor, and then we suture it shut. What are the most common types of cancer in America?
Lung.
Lung, rectal, what
And
else?
breast.
Breast for women, what for men?
Prostate.
Prostate, colon, rectal, anything else? Lung, colon, rectal, breast, and prostate. Which is the most deadly?
Lung.
Lung. Who could tell me some risks of cancer? Smoking, big one. Heredity, genetics risky? Yeah.
Yeah. UV light.
UV light. Oh, someone said UV light. Yeah, UV light.
Your appetite, your
Diet, environment, right. So all of those things are risk for cancer. Protective gear for AIDS patient. If you had a dressing change, what type of protective equipment would you need?
full body, not full.
No, full body now. Gloves for a dressing change, unless there's risk of splatter, and then you'd wear a mask, a shield, I should say. But yeah, you don't need full body for just a dressing change. How are cancer cells different from other cells? We just talked a little bit about that. The mitosis pattern, the number of chromosomes, the nucleus is larger. They regenerate quicker, right? So the cells grow, the tumors grow faster. So there's a big difference between a cancer cell and a normal cell. Who could tell me what cachexia is?
Ill health and malnutrition marked by weakness.
Yes, ill health and malnutrition. Very good. Who can explain TNM staging for me? I'm not sure what that is. Who can say what that is?
It's T for tumor, spread to the lymph nodes, and M metastasis.
Right. So tumor, and then if it's a TIS, it's tumor in situ. If it's a T0, you can't evaluate. If it's a TX, or I'm sorry, TX, can't evaluate, and so on. What's a PSA and what does it tell us?
It's a marker for prostate cancer. It tells you if the patient got prostate cancer.
Okay. It tells you something's going on with the prostate. It doesn't tell you it's prostate cancer, right? Remember, it's non-diagnostic. Okay. PSA just tells us we need to look at it. Maybe the patient just has benign prostatic hypertrophy, which just means an enlarged prostate. Men, as they get older, their prostate enlarges. That's why a lot of men, as they age, they go to the bathroom a lot. They get up in the middle of the night. They start and stop frequently. That's not cancer. That's just an enlarged prostate. So PSA tells us to look further. Okay. Are you guys clear on that?
Yes.
All right.
Thank
It's
you.
non-diagnostic. What's the first thing you do? I should have said first thing you do, but what's the first thing you do with a blood transfusion? You check the IDs. You're going to check the ID, the numbers from the patient to the donor. Okay, that's the first thing you do. If you get the blood out of the refrigerator at noon, when are you going to hang it by?
30 minutes.
30 minutes, and then it has to run in within 4 hours. Okay. Know the different types of biopsies. We know the incisional biopsy. I'm sorry, the excisional biopsy is the wide excision, right, with sutures. Incisional biopsy, usually we scope the patient and we take a little piece of tissue as their scope, colonoscopy or endoscopy. Needle aspiration biopsy, we're going to get like a little bit of fluid, maybe a little bit of tissue out. We do those on breasts. Okay. The only definitive way to diagnose malignant cells, we just said this a little while ago. What is it?
Biopsy.
Biopsy. Leading cause of cancer deaths, we just said that. It is lung cancer. Alopecia, what's alopecia?
Hair loss.
Hair loss, and it comes from chemotherapy, right? Because chemotherapy disrupts that DNA and it kills cells, and so the patients will lose hair. But it will come back when they're done. What's the worry if a patient has low WBC?
Infection.
Yeah, infection. Know the types of surgery: curative, palliative, emergency, urgent. Right? Just know those. What do you tell a patient who says he quit smoking? Oh, what if the patient says, I'm trying to get healthy, I quit smoking, but I now chew tobacco? Is that better?
No, you got a greater chance of getting a mouth cancer.
Oral cancers, throat cancers, right, exactly. What's an antigen? Someone answered that in the very beginning. Protein, right? Protein that causes something to stimulate to form antibodies. Okay. And the difference between HIV and AIDS, we just talked about. HIV is just having the virus. AIDS is when you have a CD4 count that's below 200. You have HIV positive status, and you have opportunistic infection, history of opportunistic infections. Okay, hang on one second. I'm going to just quickly look at the exam, which I think I did last week. So I just want to double check that we're on the same exam. So let's see. Okay. Any questions while we're doing this?
How many questions is it?
Let me look. So it is gonna be, let me see. Okay, so that's that one. Oh, there's one up here I wanted. Okay, hang on, guys. I'm having trouble finding it. Okay. Oh, here it is. Okay, sorry. Okay. Okay. Is elevated PSA a sign of prostate cancer? Is elevated PSA a sign of? No,
Oh, you said because it's a diagnostic, it could
it's
just
not,
be
it's not diagnostic, right? It's
Yeah.
not diagnostic, right? Okay. Symptoms. Okay. Yes, declined. Antigen. What's the average time of patients diagnosed with HIV of getting AIDS if you don't take medications? What's the average time if you don't take medications? No, it's like 8 to 10 years is average. But if you go on ARTs, it could be much longer. It could never happen. So yeah. Okay.
How would you even know what the fuck you're doing?
I know. And I know. That's some kind of practice. So I gotta do the thing. Now I know what I'm doing.
Okay.
Don't laugh. That's what I do. Think about it.
What that from me?
Okay. Okay, there's 70 questions. We literally talked about everyone. So does anybody have any questions for me on anything? All right, guys. If you have no questions, that's it. That's the review. If you did that study guide, you should do really well.
Thank
And I
you.
will see some of you on Monday and some of you on Thursday.
Thursday. Thank you.
And then I hope you all saw that ATI thing. Even if you got above an 80 on